Okay, good afternoon, good morning, or good night. I'm gonna make my final activity, oral activity. I am gonna make a dialogue of a nurse and his patient that has abdominal pain. So let's do it. Hi, my name is Diana, and I'm gonna be your nurse today. Welcome to this hospital. Can you tell me what is your name, and could you please tell me what pain do you have, and what how are you feeling, please? Hi, my name is Jane, and right now I feel a lot of pain in the abdominal. So I have very strong pain, and I don't know when it started. I think in the morning. I see, Mrs. Jane. So, could you tell me where exactly is the abdominal plane, please? Yes, my pain is in the lower abdomen and sometimes is in my lower back. Okay, could you describe me, please, uh, the sort of the pain and that you're experiencing? Is it sharp, dull, or is it cramping? Well, it feels like very strong cramps, and sometimes it feels like sharp, like stabbing pain, and sometimes it just feels like a very heavy pressure. All right, that's a very helpful information. On a scale of 0 to 10, where 0 means no pain and 10 means the worst pains possible, how would you rate your pain right now? Well, at this moment, I think 7, but when the contraction comes, it feels like an 8 or 9. Okay, I understood. Has the pain been constant, or does it come and then it goes? Well, it comes and goes. The contraction lasts about like a minute, and then I feel like some like relief. But after a while, the pain comes back and stronger than before. So, yeah. Okay, now can you tell me when exactly did the pain start? Well, it started like about like a few hours, but like in the morning. But in the last hour, the contraction were more stronger and more frequent. Okay. Do you notice anything that makes the pain worse or better? Well, when I walk or when I stand up, the pain it gets worse. And but when I sit and lay down, it's a little better, but not completely. The pain goes. Okay. Well, do you have any other symptoms that come with the pain? For example, some nauseous or fatigue or some anxiety? Yes, a little. I feel a little bit fatigue, and sometimes I have like kind of a nauseous. And honestly, I feel like anxious about and worried because about my baby. Okay, perfect. That's completely understandable, Mrs. Jane. Let me ask you, have you had this type of pain before or during your pregnancy? No, actually, this is the first time it feels like very strong before, and I only felt my discomfortable, but nothing like this. Okay, thank you for the information. I will now check your vital signs and using like the blood pressure cuff, and we're gonna be monitoring your baby's heartbeat with an ultrasound device. And well, you're welcome. Please stay calm. We will keep this under control and observation. If the contractions continue or become more painful, the doctor will give you like some medication to help relax your uterus and delay preterm labor. All right, that makes me feel better. Thank you for explaining everything.